nonprofit located in North Omaha. And our primary focus is on gang intervention and prevention. We work in North and South Omaha, but we're now part of a bigger collaboration with Omaha 360 to address violence citywide. Our basic goal is to address a variety of needs that are plaguing the community. A lot of the issues that we have come out of unemployment and lack of opportunities for the young people that we work with. A lot of them are unemployable just because they haven't been taught. A lot of them are dropouts from high school, and so we try to help them get back on the right path. And we focus on gang intervention and prevention, employment opportunities, reentry, people coming back in from the prison system, and resource referrals. A lot of the staff that works for Impact One, they've actually paid their debt to society, and now they're trying to give back. We do have people on staff who were former gang members. They've served time and they've come out and they're trying to redeem themselves working through the organization. Last Saturday, there were 3 shootings within, I believe, 30 minutes. It was on the news. The first shooting was a guy from Flatlands who was shot, I believe, 4 or 5 times. He was transported to Creighton Medical Center. His friends in a hurry, they thought they knew who did this, so they went out and they were going to retaliate. And that's why the shootings occurred so quickly. They went out, they saw a kid from 37th Street, another rival gang, and they shot him. They shot the car up, and there was a young lady who was shot. She was also taken to Creighton Medical Center, which is very bad because you have someone from Flatlands who basically just shot someone from 37th Street, but now you have someone from Flatlands and someone from 37th Street in the same emergency room.
They're not just looking out in our ER, they're also looking around our parking lots, because as she said, retaliation is the biggest thing that these people think about. And I think that that's very, very important for us to understand and to mitigate.
So when I found out that they transported the second victim to Creighton, I actually called Shelly and I called Matt and just said, hey, we got to get this girl out of here because something's going to happen. Because I knew, our staff, we knew that once her family knew she was there, they were actually going to come up, her family and her friends, to Creighton, and there would be a problem.
We kind of had them in a centralized location, but they could see that some of the women, some of the aunts were dipping into their purse, and so it was very quickly going to escalate for us because they were drinking. So some of those things I just would not have even comprehended or noticed. So
it's a double-edged sword. We've been really successful at getting like very, very dangerous gang members to put their guns down to stop, victimizing the community. But then on the other side, once they put their guns down, they become easy targets, like sitting ducks.
We've got this gang member who's coming in with Barbara, and he was trying to not be in the gang anymore, so he was kind of being targeted. So she called me so that he was coming in for medical care, so that we didn't keep him in our waiting room. We got him quickly into a room for care, never even missed a beat on that. And that's the kind of example where our collaboration can be very, very important.
There was one kid in particular, we were able to get him a job. He was working at McDonald's full-time. He worked for our summer job program, and then we got him a job at McDonald's. We were trying to get him enrolled back in school at Metro. And it just happened, he started hanging around his cousin who was still involved in gang activity. They were both shot and killed November 7th. And I hate to say this, but honestly how I felt was that I'm like, here we are, we get this kid to put his guns down. We would literally be on him, you can't carry a gun, you're on probation, you can't do this. And he listened to us, he put the guns away, stopped all that, and he ended up being killed.
We even had a family of a gunshot victim request that Impact One be there when life support was removed. So that again goes to show how that relationship with the family becomes very, very important and is something that's meaningful to that family.
I think overall we've been very, very successful. A lot of our kids have actually went on to college. A lot of them have went on to get full-time employment. A lot of them there's like a very, very significant decrease in recidivism as far as them going to DCC or the prison. So I know that we're successful.
It takes a comprehensive approach. It's not just a specific